Hi everyone, welcome back to my channel, Dave Dismantled. This is Tales of Tyranny, Episode 2, Alberta Governments, Corporations, and COVID Guidelines. Now when I talk about Alberta governments, I mean obviously the provincial, but every single municipal government as well, particularly those that have enacted face covering bylaw or other bylaws associated with COVID-19. So the first place I'm going to start here is with Deena Henshaw's public health order, or the Alberta government's public health order. And just if we go down to the third paragraph in this document, it says, whereas under section 29 2.1 of the Public Health Act, the Act, I have the authority by order to prohibit a person from attending a location for any period and subject to any conditions that I consider appropriate, where I have determined that the person engaging in that activity could transmit an infectious agent. I also have the authority to take whatever other steps that are, in my opinion, necessary in order to lessen the impact of the public health emergency. So what this lady, Deena Henshaw, is saying, who's not an elected official, by the way, what she's saying is that this piece of paper called the Public Health Act, it's actually that piece of paper that grants her the authority to prohibit a person from attending a location for any period and subject to any conditions that she considers appropriate. It also says that she has the authority to take whatever other steps that are in her opinion. Not an elected official. I mean, it doesn't even matter if it's an elected official, but she's not. So she's not a representative of anybody in the system of slavery called government, okay? But she believes, the rest of the government believes, and most of the people in this province seem to believe, that because a piece of paper called the Public Health Act says she has these powers, she believes that she can command you to not have anybody come over to your house, to wear a mask, and whatever other guidelines she decides in her opinion. What if her opinion's faulty? What if it's wrong? And then we move on to another group of delusional psychopaths from the City of Airdrie bylaw. Because listen, if you believe that a piece of paper can grant you power over others so that you can command them so they can't have people come in their house, and you expect people to listen to you and you'll use force and punishment if they don't, you're delusional and you're a psychopath. Primary or secondary. Straight up. In the Airdrie bylaw, it says in the fourth paragraph from the beginning, whereas pursuant to Section 7 of the Municipal Government Act, Revised Statutes of Alberta 2000, Chapter M26, and amendments thereto, a council may pass bylaws for municipal purposes respecting the, and then it goes on. So again, these people at the municipal level believe that a piece of paper called the Municipal Government Act gives them magical powers over others, that they can command them what to do, and then they can decide what a punishment is if those people don't comply. So at the municipal level, we have a group of delusional psychopaths that believe they can use a piece of paper to grant them authority over others, to have powers over others, to command others, and to punish others, and at the provincial level as well. And dare I even say at the federal level, specifically and especially. So now we have two pieces of paper, the Public Health Act and the Municipal Government Act, and people believe that these simple documents grant magical powers of the creation of rights and the denial of rights to other human beings. Honestly, so because they've mandated masks at both the city level, you know, Edmonton, Calgary, Airdrie, where I am, and now at the provincial level they've mandated masks. let's just go over a couple of things about masks, shall we? Here it says from the World Health Organization on this link, the use of a mask alone is not sufficient to provide an adequate level of protection against COVID-19. This is from the World Health Organization website. So, that's interesting. Let's put it in some context now. So, the Alberta government, the provincial government, has released documentation, guidelines, if you will, guidance documentation for retailers and businesses and other businesses that the steps they can take to reduce the transmission of COVID-19. So the government's come out with these documents. They're a guide to retailers. I own a small business. I've read the documents. So let's go through a couple of things in them quickly. Here's the general relaunch guidance from Alberta government, September 2020. If we go down to page 9, 6, 7, 8, 9, there we go. On page 9, infection prevention and control. Okay. Here in the document it says, a numbered list of controls to reduce the risk of COVID-19 are found below. The most effective and protective controls are listed first. When considering which controls to use, operators should start with the most effective and protective, and should use combinations of controls to offer the best protection. All operators need to consider their specific settings and services to determine the best way to reduce risks for attendees. And attendees are employees or people coming into the business. So remember, this is a numbered list with the most important first. Okay, so this is in order of importance. Number 1, elimination. Remove the risk of exposure. One of the specific things in this section says an operator should post signs that instruct those who may have been exposed to COVID-19 to not enter. Okay, that's one of the most important things. Put a sign up. If you're sick, been exposed to COVID, don't come in. Okay? So 2 is substitution. Alternate means of attending a location or receiving services. Curbside pickup, delivery, that sort of thing. Number 3, engineering controls, barriers and other physical controls. So partitioning, the plexi, all that sort of stuff, right? Number 3 on the list of importance. Not quite as important as putting up a sign on your window that says don't come in if you're sick, but still, you know, number 3. Number 4 is administrative controls, distancing, disinfecting, hand hygiene, respiratory etiquette. So stuff that we would typically do anyways, except the distancing. So cleaning and disinfecting, hand hygiene. And the number 5 on the list of importance, so 1, 2, 3, 4, we're in the 5th now of importance, is personal protective equipment. So those are going to be things like gloves, gowns, goggles, that sort of thing. Okay, so that's 5th on the list of importance. Now we come down to the last item, number 6 on the list of importance. Community protective equipment, non-medical masks. The last item in the list. And remember, this is done by importance. So, according to the Alberta government's documentation, it is more important for a retailer to post a sign in their window that says if you're sick or been exposed to COVID-19, don't come in the store. That's more important than a physical barrier, and much, much more important than wearing a mask. So why do they make the mask mandatory if, according to them, it's the least important thing to do, and according to the World Health Organization, a mask by itself is not adequate protection from COVID-19. So if they can't control the other things and the other things aren't mandated, and the mask is the least important, and it doesn't really do anything by itself, why make it mandatory? Now, further to the corporations in this Tales of Tyranny episode, they really work behind the scenes to really bring this tyranny down on people, right? Because when you get the small businesses shut down, you can only go to the big stores, the franchises, right? The ones with the corporate head offices, right? With the board, okay? The people that go and talk to the government, that work with the government, that get tax breaks from the government, okay? If we look at so I went through some of the general relaunch guidance and the guidance for retail businesses. If you read through the documentation, most of it is recommendations, shoulds, and considers, right? So not must, not have to, but consider, okay? So they're suggestions, they're guidance. So if you look through some of these things, let's take a look at, I don't know, when you go to the bank and there's a big sign at the front with all these symptoms that you might have, or if you've been exposed to people. Well, guess what? That is actually just a consideration for the business to do, as in under this section right here. Consider implementing active screening of attendees. Consider implementing. That means you don't have to do it. Yet, all the corporate controlled businesses, all the banks, all the grocery stores, all those places all do it. Many of them do it. Even managers within businesses have to screen their employees, not just people coming into your store, okay? But it's just consider implementing it. So if you don't have to do it, why would you add additional burden to everything and subject people to having to give personal information out? So these are all considerations, much of them. And believe me, I went through the documentation and I had to do some of these things at my business so they wouldn't shut me down. They threatened to shut me down. Public health inspector. So read through this documentation. You can see most of it's a suggestion. One of the only things I found that I had to ensure that I did as an employer was make sure that gloves were available, like the disposable gloves were available for staff if they're handling cash. It said ensure. So that to me meant I have to do that, right? But a lot of this other stuff you see with the barriers and the masking and the mandatory masking, nah, even considerations in their own document before they made it mandatory. So why would they mandate this? Things are bad, right? Cases are up. It's really bad. There's lots of cases, lots of testing, lots of cases. Well, let's look at why. Okay, we'll go back to the Alberta Government COVID-19 Statistics website, okay? Here we are. Oh, look at that. Jeez. If you're under 59 years of age, you have a 0.3% chance of fatality. 99.7% survival rate. Oh my goodness, we have to mandate masks. We have to lock things down. The corporations have to help the government mandate masks and have no consideration for medical health conditions or anything like that, right? The cases are up. But if you're under 59, you have a 99.7% survival rate. Yes, as you get into the 60 to 69, you got a 98.3% survival rate. So, still pretty good, I'd say. Of course, from 70 and then into the 80s and 90s, the percentages go up. But remember, the majority of these deaths, if you go to the comorbidities section, the vast majority of these deaths are people with 3 or more comorbidities. Right here, 3 or more conditions. Yeah, there's some deaths. Yes, most of them are at the top of the age range. which makes sense because when you're old or you're already in a care home and you've already got some existing conditions, yeah, of course you're going to have a reduced chance of survival from any sort of infection, be it bacterial or viral. And if you look at the comorbidity section, what you're going to see is that there's a very, very high double-digit percentage of people that had things like respiratory diseases, cardiovascular issues, diabetes, that sort of thing. But they're mandating the least important thing that isn't adequate protection by itself for you to wear a mask. And they're locking stuff down and they're putting in curfews because you've got a 99.7% survival rate if you're under 59 in Alberta, according to their documentation and their data. Wow. Just wow. Wake up, man. Wake up. First of all, these people believe that they get their authority from a piece of paper, and second of all, their own data doesn't justify what they're doing. Well, I think that's it for another episode of Tales of Tyranny. Thanks for listening. Take care.